Silicone or saline? Those are the options for breast implants now that the U.S. Food and Drug Administration recently lifted a ban on silicone implants. 23 ABC's Aaron Calandra joins us now with the newly formulated silicone implants. Aaron?
Mike, after years of scientific review, the FDA lifted its 14-year ban on silicone-filled breast implants. But before you make a decision on silicone or saline, there are a few positive and negative things to consider. The controversial implants are now available for women 22 years or older. This after the FDA reviewed data from clinical trials of women studied for 4 years. Local surgeon Dr. Darshan Shah says the FDA made their decision after thorough research.
The combination of better implants that are made better and the proof that there is no relationship between major diseases and the silicone has convinced the FDA that this is enough evidence for them to allow silicone implants to be placed back into the market.
Previously, silicone was very thin, so when it leaked, it easily traveled through the breast and into the bloodstream. But now, the formula for silicone has improved.
Now the silicone implant is made with a thicker gel that stays together, kind of like a Jell-O, and that when you cut it, it doesn't leak all over the place. It's called cohesive gel implants, and they have a thicker shell.
Although the thick gel sticks together and usually doesn't travel outside of the breast, a leak can only be detected through an MRI. For this reason, doctors recommend MRIs every 2 years. Besides the risk of leakage, silicone implants come pre-filled, which means the incision has to be at least 1.5 inches long, and silicone can only be inserted from underneath the breast. We spoke to a local woman who's getting implants tomorrow morning, and for those reasons, she chose saline over silicone.
The silicone, they're already pre-filled, so you can't make any adjustments. So that was my main concern, is the adjustments and the incision.
Tiffany says her best advice for a woman considering breast implants would be to learn about your options before making a decision.
Just to do their research and find a doctor that they feel totally comfortable with and that they trust.
Doctors say there are pluses and minuses to having silicone implants. Some of the negatives are that they're pre-filled, which means a larger incision is needed. Any changes to the body from the procedure is usually irreversible, and silicone is hard to detect. So MRIs are recommended every 2 years. Some pluses are that they have a more natural look and feel, and there are several shapes and textures to choose from. Silicone implants usually range around $6,500. Todd, Mike, back to you.
All right, Aaron, thank you. New research says women who cut back on smoking actually have a higher death rate.